Good evening and Happy New Year, community members of Evanston. My name is Ike Ogbo. I'm the Director for the Health and Human Services Department. And with me is Paul Zamazak, as you all know, who is our manager for the City of Evanston, and Greg Olsen, who is the Public Health Manager. And this section is called in regards to verification mandate that will go into effect come January 10th, 2022. The reason for this session is to address any issues or concerns or any inquiries that you have about the order that will be implemented and effective come January 10th, 2022. But before we start, I would like to provide an overview of the order and hopefully address some of the questions that I have received so far in that regard. So this order primarily tailors that of Chicago and Cook County. As we perhaps know, Chicago and the Cook County Health Department issued mandates that went into effect in Chicago and the respective county areas of Illinois, which is Cook County. Our order primarily follows or tailors this order with a few revisions. I have received a few phone calls and some emails in regard as to is it any particular reason why we are following suit. There are many reasons why we are following suit, not only to be in solidarity with Chicago and Cook County, and others are following suit. We have Skokie and Oak Park, which have separate certified health departments as ours, but we see the advantage of implementing this mandate, and this mandate hopefully wouldn't be one that will be a permanent one. We're hoping that this mandate will help curtail the influx of cases in Evanston that has been presented due to this COVID-19 surge. So, of course, this is a mandate that I know would be hard for some individuals or some businesses, but we are here as a city to support. The notion and the direction is to protect our community members and not to present any hardship to any of our businesses in this regard. And all of us who have been in Evanston throughout the pandemic know that in order for us to implement strategies and protocols, we follow science, data, matrix, to make informed decisions. And the vaccine verification order is one of those decisions that we are making to continue to keep us safe. The rationale behind it is pretty much based on the number of cases, the surge that we have been experiencing in Evanston, which has been very unprecedented. This is the highest that I've actually seen it throughout this pandemic. Our positivity rate at this point is over 10%. Not only that, our cases on a 7-day moving average exceeds 100. So that shows you that we are in a surge and we are applying any method necessary in order to curtail or reduce the number of cases. And not only that, Evanston is not a bubble, and it has been very remarkable of how Evanston community members have believed in science and facts to get vaccinated. Our vaccination records have been commendable at this point. But Evanston is not a bubble. We have people whom we welcome who come to our businesses and our restaurants to dine from all walks of life, and even in areas of low vaccination rates. Our vaccination rate at this point is close to 94% for those who received the first dose, 84% for those who are fully vaccinated. But as I mentioned, Evanston is not secluded. We have a number of people who come to Evanston, and we want to make sure that we put protocols and strategies in place to continue to protect our community members. So I just wanted to provide that little spiel. Just to provide a little bit of illustration, I would like for Greg to show where we are in terms of positivity rates and hospitalizations so that you can see the effects of the influx of cases. And one thing that I would like to mention before Greg shows those graphs is that we have started to see an increase in usage of our ICU beds with individuals who are vaccinated. When people say that there are likelihoods of individuals who've been vaccinated or transmitting the virus, yeah, that's the possibility of that. But once you're vaccinated and you get the booster shots, it prevents severe illness, hospitalizations, and deaths. That's the reward that we get for being vaccinated. The unvaccinated individuals, yeah, they can get the virus, and it will cause, usually, and what we have been seeing based on data, is severe illness, hospitalizations. And one of the tenets for implementing this order is not to overwhelm our healthcare system. We do not want to do that. We want to support our healthcare system by keeping people out of ICU beds or the COVID beds. So Greg, if you can do us justice, can you please show some of those illustrations, and if you can.
Thanks very much for joining us today. Let me share my screen real quick. So just wanted to provide a little bit of context as it relates to the pandemic as a whole. I know Patrick and the city has been sending out weekly updates, communications updates, saying where we are. But I think it's a good idea to take a step back and get a bird's eye view of, what we've gone through and where we're at. So what we're looking at right now, it's the daily cases in Evanston, and those are the blue bars. The red line is our 7-day moving average of cases. That's typically a better indicator because, it accounts for different daily fluctuations, so it just gives you that weekly average. And then the orange line, that's the 7-day positivity rate. So how many cases resulted from X number of tests conducted for that day. And so this graph is showing from the beginning of the pandemic all the way till present day. We had a blip in November 2020, but as you can see, presently we have far surpassed our former high for the 7-day moving average, and that was 37 cases for the 7-day moving average back in November 2020, whereas now, like Ike was saying, it's roaming around 100. So that's showing that it's very prevalent in our community, and we'll show a few more graphs that can kind of see the results of that. All right. So this is a graph showing weekly new cases per 100,000. This is a metric that's used to compare different populations. So it normalizes the number of cases with regards to the population size. So here we have Evanston, Skokie, Chicago, and Illinois as a whole. And we're all kind of doing the same roller coaster loops. And right now, all of us are on the upswing. So Evanston in the beginning has fared a little bit better. However, we're still right there with everybody else currently. We're hovering around 1,000 cases per 100,000 residents for a week. So, I mean, that just kind of goes to show that Evanston, as Ike was saying, is not in a bubble. Our surrounding communities, Skokie, Chicago, Cook County, we're all kind of experiencing the same thing at varying different rates, but pretty similar. And this graph is mainly to show the hospitalization. So this is what we're trying to prevent. And this graph is it's only about the last 3 months, 2.5, 3 months. It's October to present day. And we're seeing an uptick in our hospitalization rates. The majority of the North Shore patients have been going to the Glenbrook Hospital. But really the one that you want to pay attention to is the green line. I apologize for all the bunched up numbers, but I mean, really just the gist of it is that that green line is increasing, and that's the total number of hospitalizations of either COVID positive individuals or patients under investigation. So that's what we are trying to prevent. Even though the hospitalization numbers are increasing, the vaccination rate here in Evanston is extremely high. So even though we may have hospitalization rates that are going up, the risk of it causing a severe disease and death due to COVID-19, the vaccine greatly decreases that risk. And I think one of the Q&As I saw was that Omicron may not, the vaccines may not work for Omicron. And just an update, so the CDC released a document on December 27th showing that data from South Africa and the United Kingdom has demonstrated the effectiveness of the 2 doses of the mRNA is approximately 35%, but when you add in that booster, it jumps it all the way up to 75%. And it's important to note that this is for decreasing the risk of severe disease, hospitalization, and death. That's what those percentages are for, not necessarily not getting COVID. It just says that if you do get it, your symptoms will be milder. But you know, that being said, no vaccine is 100%. So, but we can just show from these graphs that, you know, what we want to do is prevent more hospitalizations, which is why ourselves, along with Chicago, Cook County, and Skokie, have taken these further actions of the vaccine mandate.
Thank you very much, Greg. Now you can see the reasons why we put certain protocols in place. We don't pull it out of the hat. We take a look at our data before moving forward with new directions, and this is just one of them. And as I mentioned earlier, we are hoping that the surge will be temporary. We don't hope that this mitigation activity of vaccine verification will be something that will be permanent. So we're looking at controlling this surge, and once it's sustained and controlled significantly, we can take a look at the order again and make any adjustments or revisions needed. Okay. So what I would like to do is I would like to go over the order and provide some context and overview of the order. Then after that, we can answer any questions that we have. There were a number of questions that were submitted beforehand. I would like to attend to those first, then any other questions that we have during this session. Okay. All right. So the vaccine mandate is for anyone who is 5 years of age, showing a vaccination card or proof of vaccination before entering any business. Businesses must require those who are 18 years or older to show proof of ID that matches the vaccination document. Any ID pretty much will suffice as long as it's government issued or if it's school issued. We'll take that. If it's a passport, that's also acceptable. Signage will also be posted at all entrances of the facility. We took the liberty to make some signage, and it's posted on our city's website where you can download and print and post at your facilities. We are encouraging employees to get vaccinated. It's either that or submit to weekly COVID tests. We are leaving this in the hands of the restaurants owners and other businesses that are covered by this order to fashion plans on how to assure compliance. We are not asking that you document the vaccination cards or the weekly COVID test, but have a method or form where you can verify that your employees have complied. We've also taken the liberty to provide a document that you can use. It's very user-friendly. We call it a compliance verification document that you can use, but nothing to bar you from creating your own system that works for you. But we just wanted to make it easier for our businesses. So the point is, if your employee is not fully vaccinated, that they submit to weekly COVID tests. Okay. So which businesses are covered under this order? The businesses that are covered under this order are indoor settings where food and drinks are served, inclusive of our health and fitness centers. So the indoor dining establishments range from restaurants, breweries, food kiosks, food halls, food courts, cafes, you name it. They are all covered under this order. Event spaces, community centers, hotel ballrooms where food are served, yes, are covered under this. Recreation and entertainment centers or venues, like places where they play live music, theater, bowling alleys, clubs, they're all included in this order. Places of exercise and recreation, our recreation centers, our fitness clubs, our gyms, kickboxing and boxing arenas, sporting arenas, they all are included in this order. So who is fully vaccinated? I think by now we mostly know what the definition of those who are fully vaccinated means. It means 2 weeks after receiving or completing the series of Moderna and Pfizer. That also includes the 2 weeks after receiving a single dose of Johnson & Johnson. So that's what being fully vaccinated means. With this order, we do not include the booster vaccine. If that's the direction that we will go into, that will be communicated. But for right now, the focus are on the 2 series of the Moderna and the Pfizer vaccine and a single dose of the Johnson & Johnson. Okay. So what is a proof of vaccination? It is a vaccination card, a CDC vaccination card. Most of us have that. An official immunization card that is obtained by the jurisdiction that you live in, the city, the county, the state, or even the country. Or you can upload or download it from an app. Illinois uses this app called Vax Verify, where you can log in, provide your information, and have the capability of downloading your vaccination records. What I recommend is for you to have easy access to your vaccination cards is taking a photo of it. That's allowable. Making extra copies of your vaccination cards and maybe putting them in different wallets or purses that you travel with, so you can have it accessible at all times. We also made some considerations in regards of those who do not qualify under this order. Those who have medical exemptions or do not are exempt from this order. Those who have strong religious beliefs, as long as it is attested by a religious institution or religious leader, are exempt from this order. But upon entry into a facility that is covered under this order, that individual will have to provide a COVID test. Individuals who are going into a facility covered under this order for ordering food, doing takeaways or doing deliveries, or just simply using the toilet rooms less than 10 minutes are exempt from this order. Also, an individual 18 years age or younger who enters a business to participate in a school activity or after school program by any pre-kindergarten through 12th grade, non-public school or public school are also exempt from this order. Other exemptions include places of worship, individuals attending K through 12 schools, preschools, daycares, after school programs. Another exemption given are indoor locations in a residential or office building. Those residents are exempt from this order. So that's a summary of the order. It covers exemptions, it covers the covered entities under this order. It also covers proof of vaccination, what you present. And we are not asking for our business owners to document the vaccination records of their patrons or customers. All we are asking is that you verify that they are fully vaccinated before they proceed into your dining space or into your business. And as I mentioned as well, for your employees, it's either they get vaccinated or they submit to weekly COVID tests. It is left for the business owners to make such verification, whatever system that works for you. We're not asking that you maintain the vaccination records or the COVID test results, unless if you get consent from those individuals to keep those records on file. So that summarizes the order that we are going to implement come January 10th. And what I would like to do is to, first of all, as I mentioned earlier, is go over a number of questions that were submitted beforehand. And if there are some questions, I see that there are some that have been submitted already through the Q&A and chat. We can go ahead and start addressing those questions. So give me 1 second. All right, let's start with the number one question I got. Could we please have signs and directives in Spanish? It is something that we're working on. It should be posted on the city's website. Currently, we have it in English that is downloadable on the city's website that you can post at your respective businesses. The vaccines have shown minimal ability to prevent Omicron, which is the surging positive test transmission. Omicron symptoms are extremely mild, being compared to the common cold. So this question is in regards to the purpose of vaccinations and whether our vaccines are effective enough in controlling the Omicron variant. According to CDC, and data suggests that it's likely that the current vaccines that we have, coupled with the boosters, will be able to control Omicron. I just received communication from IDBH a few minutes before this call that also confirms what I'm saying, that early tests, early data suggests that the vaccines coupled with a booster will provide protection against the Omicron variant. And that the focus should also be on, even though the virus can be transmitted amongst those who are fully vaccinated, it prevents severe illness amongst this group, where we are finding hospitalizations being high across Illinois are amongst those who are unvaccinated. I own a restaurant that has not opened for indoor dining since the beginning of the pandemic. Do we need to post any signage or submit anything to the health department documenting that we do not offer indoor dining? All right. So in this case, this order does not fully pertain to a restaurant that is not doing indoor dining, but it pertains to the employees who are working at the facility that they must be vaccinated and submit to weekly COVID tests if they are unvaccinated. All right, so this is a long one. I was trying to shorten it. We are employees of an Evanston dance studio. We beg you to enforce the proof of vaccination order. Our employer plans to get around the order by saying that they are after school programs. Our students come from Evanston and other suburbs of Chicago, breathe heavily as they dance for long periods of time, remove their mask to drink or eat snacks, and various other activities. So in essence, what this complaint is about is to ensure that we carry out this order in an effective way, that there are people who will try to bypass this order to say that they are in after school programs. The order does exempt 18-year-olds or younger to participate in after-school programs. So if you are in a facility that offers after-school programs or daycare or participants that are K through 12, those individuals are exempt to the order. And as I mentioned, we don't hope for this order to be something that will be permanent. We're hoping that we would do well to control the surge with a number of strategies that we are employing. Okay, so but after school programs are exempt from this order. Does someone need to be medically exempt with a doctor's note to provide negative test results in place of vaccinations? Yes, we do have a medical exemption in the order. In this case, you'll have to get a note from your medical practitioner and provide a COVID test 24 hours prior to entering these businesses that are covered by this order. I have questions regarding coffee shops, bakeries, where we go through a lot of customers pretty fast. That alone might be challenging because it isn't like a restaurant where a server has plenty of time to check IDs or vaccination card. In that setting, do all customers need to show proof of vaccination, even if they are picking up something or not eating at the cafe? As I mentioned, if you're picking up your food, ordering food, and it's less than 10 minutes, you're exempt from this order. So to this point, anyone going into a facility to use the toilet rooms, order food, deliver food less than 10 minutes is exempt from this order. 8. What is the time span for unvaccinated employees to be tested weekly? Will Evanston Health Department mandate all employees to be vaccinated in coming months? So this order goes into effect come January 10th. So as I mentioned, weekly COVID tests will have to be submitted to the employers every week. So it will start come next week that these individuals submit to COVID tests for those who are not vaccinated. Will the health department mandate all employees to be vaccinated in the coming months? That's at this point not, we are strongly encouraging everyone to get vaccinated. We don't have a mandate specific to getting all employees in Evanston vaccinated. As I mentioned, the order is in particular to the covered businesses that I mentioned here. It's either the employees get vaccinated or they submit to weekly COVID tests. All right, I have one question. We run a soup kitchen and prepare to-go meals for our guests. Our lunches are served outside the building, presuming that it is still an okay process. We have not served inside since March 2020 and have no intention of returning to inside service in the immediate future. I'm sorry, I'm not able to. Okay. All right. So this pretty much means that they are serving outside. So this order does not pertain to outside food service. If they want to move this operation inside, then it will qualify. But we also give an exemption to soup kitchens. So if there are individual restaurants cooking outside, this order does not pertain to them. But once those operations move inside the restaurant, then the order applies. For organizations with regular long-term students like ours, will like to just keep a copy of their vaccination card on file rather than having them show it every time. If this is permitted, can we start collecting this info on January 10th and give a deadline? This is absolutely fine as long as I mentioned, you get consent from your employees to store such data. There is nothing in the order that debars this activity. But what we would like you to do is to make sure that you convey to your employees that you are maintaining their records in one system or maybe database or another. All right, this is a long one, so I'll try to shorten it. Why are restaurants and bars allowed to remove their masks while seated, but our members must remain masked at all times? And this is from a gym owner or a gym manager. Well, for restaurants, you are to remove your mask when you're actively eating or drinking. So our mask mandate is still in effect. Our mask mandate was issued in August of last year and is still in effect. So it still pertains to any indoor setting, including restaurants and gyms. So in this case, if you're at a restaurant and actively enjoying your meal and drinking, you can definitely remove your mask. The same applies to gym. If they need to, if the participants or the customers need to get a sip of water or eat, they can as well take off their mask. So I think that's what the question is saying. All right, so there are three questions here. Is fully vaccinated 2 weeks after? Yes, 2 weeks after the series of Moderna, Pfizer, and the single dose of Johnson & Johnson. Are 5-year-olds being vaccinated? Yes, they qualify to being vaccinated. We conducted a number of vaccination events for 5 to 11-year-olds, so they qualify to be vaccinated at this time. Must an employee that has been out sick with COVID show a negative test before returning to work? So if an individual tests positive, irrespective of vaccination status, that individual will have to quarantine, isolate in this case, isolate for five days. If they're feeling better after the 5 days, they can return to work. CDC, as maybe some of us or many of us know, are now recommending a shortened isolation and quarantine time, which IDPH adopted a few days ago. So we are following that recommendation in terms of reducing the quarantine and isolation time. Data does suggest that people who contract the virus are most infectious 1 to 2 days before the onset of symptoms and 2 to 3 days after the onset of symptoms. And that's why they came up with that 5-day isolation or quarantine time. Some of these questions are repetitive. Okay, here's one. Does this order cover those who are 5 years of age, who will turn 5 years of age when the order becomes effective? So what this question is saying is that a community member is 4 years old. Would this order apply to them when they eventually turn 5 years old and they're not fully vaccinated? As you know, we don't have any vaccines yet for those who are less than 4 years. So if the individual will be turning 5 at the time that this order will go into effect, we'll give that individual a grace period. We'll give that individual a grace period of 6 weeks to get fully vaccinated. All right, I think that's it for now. So we have a lot of questions. I'm trying to see how much time do we have. We have 20 minutes. And what I plan to do as well is to compile these questions and provide responses and put it on the city's website so that we can all refer to them if we have any questions. I don't know if I'll be able to address about 50 questions in a space of 20 minutes, but let me try my best. All right, let me see.
Yeah, Ike, and we can also grab the contact information for the participants today. So when we go through our Q&A, we can reach back out.
Right, absolutely. All right, so this question is, are saloons included? So if you have a saloon where food is being served and drinks are being, foods are being served and drinks are being consumed on the premises, this will pertain to you.
Like, I think the question was like hair salon or nail salon.
Yeah. So if, for example, there's a hair salon or a bookstore where they have, let's say, a food license to serve food, and food is being served and drinks are being offered, and there's some food operations, that facility would qualify to be in this order. Okay, so please tell us the exact name of the Vax app he was suggesting. So what I will do is get your information. I can or send it to the group. The app that we have discussed. It is called Vax Verify. Greg, maybe you can type it into the chat. It's called Vax Verify.
Hey, Ike, I'd like to get the Vax Verify app information out to all of our businesses. I know I've been able to download it on my personal phone, and you can
Okay.
scan anybody's vaccine information. Anybody can do it. You don't have to be a business. So I'll make sure that we get a message out with that information.
Great. All right. I think that's a remarkable idea, Paul. Thank you. All right. So this is a question. How should we approach this order as a small restaurant business? We don't have servers, but people can still sit and eat inside the restaurant. Do we eliminate the possibility of dining in? No, we are not asking that you eliminate the possibility of dining in. The verification process, to me, doesn't take that much time. All we're asking is when a patron comes to present that they have been fully vaccinated, and that's all we are requiring. You don't have to eliminate your dining options to perform this activity. We're just asking for verifications, and that's it. You don't have to download the information. You don't have to document the information. We're just verifying, and that's all we're doing.
Hey, Ike, one thing that I'd like to say real quick is, so since COVID-19 began, there's been every single scientist you can think of has been doing research about COVID, about different aspects of how it's been affecting our lives. But since we're a certified health department, we have to follow the guidance that's been given by the Illinois Department of Public Health, and they follow the CDC. So I know there's lots of differing studies, whether from different outlets, but we would have to follow the guidance from Illinois Department of Public Health because the information that they provide has been appropriately peer reviewed and following the guidance of the CDC. So, I mean, we're not blind to the other studies that are going on. They're very interesting, but until they get properly peer reviewed through the appropriate channels, the wisest decision is to follow the guidance of IDPH and the CDC.
All right. So, all right. Thank you, Greg. And you are right. We have, throughout the pandemic, followed the CDC IDPH guidelines, and we also have the authority to tailor our guidelines to the recommendations and guidelines on a local level, and we have done that on numerous occasions in Evanston. So this question is, does each business need to send any kind of documentation to the city? And do we need to use the signs provided, or can we use our own if we already have them? If you already have them, great, yes. You don't have to submit any documentation to the city, but we would like for you to keep documentation just in case we ever need it. If we need to follow up on some cases, if there's some positive cases that we need to conduct case investigations on, we would like for you to keep some documentation so that we can refer to them. All right, so this other question, dance center. Okay, how about businesses that cater to kids under the age of 5? The majority of kids play spaces in the city may serve food, but depend on admissions from kids ages newborn to 8 years old. Many parents have not yet had a chance to get fully vaccinated. So this order pertains to those entering into businesses who are 5 years and older, who can pretty much get the vaccine. There's no mention of those who are less than 5 years of age. So this order does not cover those individuals. This order is particularly to those who at this point could be fully vaccinated, which are 5 years and older. All right, there's so many questions here. Okay. Let me see, pick and choose. So one of the questions says, cases don't matter if symptoms are mild, stop tracking cases and start reporting fatalities. Common cold cases will also increase without casualties. Why not more truthful on what matters? Yes, we do report casualties. We do provide number of cases of those who have been affected, who have contracted COVID on the city's website. At this moment, we have 129 fatalities due to COVID. So that's provided on our city's website. So if you haven't had the opportunity to look at it, it's very informative, where it provides testing information, it provides a number of cases. So it is a very informative dashboard that we have on the city's website. With reference to ID, I think you said 18 years or older, but Signage said, sorry, if I said 18 years or older, please forgive me. It is 16 years or older. So yes, it is 16 years or older where they present an ID, and a government ID will suffice. A state ID will suffice, a driver's license will suffice. So the places people are trying to improve their immunity through social well-being and exercise are prevented from. This keeps going up and down. Okay, so the places people are trying to improve their immunity through social well-being and exercise are prevented from doing so if they choose not to take the health risk of the vaccine. Well, as we have been sounding, as we have been encouraging everyone to get the vaccine, there's a reason why we are so confident in that it prevents hospitalizations and severe illness. And I understand that there's some people who want to achieve a natural immunity to COVID. The issue with that is we have to have enough people vaccinated in order to provide herd immunity. We have experts and epidemiologists saying we have to be 70 to 80% vaccinated as a nation in order to achieve that, and we are far from that. So using natural immunity might not be so dependable at this point than taking a vaccine that has been proven to be safe and effective. So are persons under 18 exempt from vaccine proof documentation to enter, use recreation facilities? So if they are entering community centers, recreation facilities, K through 12, they are, as I mentioned, exempt from this order. What is the Emerson requirement for number of, this keeps jumping, sorry. What is the Emerson requirement for number of quarantine days if infected? As I mentioned, we're following the CDC guidelines of 5 days. And if after five days you still exhibit symptoms, we're not asking that you release yourself from quarantine. We want for those symptoms to resolve before you are released from quarantine. But the magic number are 5 days. Vaccinated and unvaccinated people both pass the virus to other people. This is why we all need to wear masks. So why do we have to separate rules for the two groups? The mask mandate is still in effect for indoor settings. We have not separated the two groups. The difference between those who are vaccinated and unvaccinated is with the vaccinated individuals, as I continue to mention, the risk is lower for severe illness, hospitalizations, and death, but nothing in the order is separating masking to groups who are still asking for masking when you are in indoor settings. All right, research is updated all the time. Please bypass CDC and get the real research from all over the world without the political funding. It's less deadly, bypasses vaccinations, natural immunity. In the meantime, we are not just hurting businesses and potentially people who have negative reactions from the vax, but devastating physical and emotional. The purpose of the order isn't to create hardship. As I mentioned earlier in this segment, hardship for the businesses, that's not the purpose whatsoever. What we are doing is implementing a protocol that we, through data, would curtail the caseloads in Evanston. And as I mentioned, this is not a mitigation activity that we want for it to be prolonged. If we are able to sustain a low incidence rate or infectious rate in Evanston, we will consider revising or adjusting the order. So this order in no form or fashion is to be punitive to our restaurants or our business owners. We are just putting plans in place to curtail, as I mentioned, the spread of the virus. And one thing that I would like to mention is that our Evanston community members have been awesome during this pandemic by complying with the protocols, by the public health directives, and we have done well throughout this pandemic. It is just that we have the surge that we have to tackle. Our community members have believed in facts, have believed in science to get vaccines, to follow protocols, and it makes me proud to be part and parcel of this community. So I just want to say thank you to our community members who have taken this seriously and have complied with public health protocols, knowing that once applied appropriately, that we'll be able to hopefully in the near future get past this pandemic. All right. So I got 5-year-olds are virtually immune from COVID, yet suffering and dying from vax. According to VS, is your conscience able to handle it if this mandate for 5-year-olds results in fatalities? As a matter of fact, our recent data in Evanston shows 30% of our cases are from daycares and schools. So we are seeing cases in our schools. We are seeing cases all over the place in all ages. So we do have that data handy. And it's something that I reviewed before this session. I think I missed a few. Let me go back up.
Hey, so one of the questions is, are we under obligation to know if cards are fraudulent? No, we're not asking you to investigate whether a card is real or not. This is already a lot on your plate. So we don't want you to be detectives and figure that out. A lot of this is, good faith. But do your best to ensure that an individual has provided their vaccination records. If there's any question about any sort of record that you've been shown, please reach out to us, and we'll do our best to assist you.
Thank you, Greg. I must have missed that one. So I have another one. Do congregate settings have to post a signage and screen visitors for proof of vaccination if guests are just visiting? So unless food is being served, you have a license to do food operations. Any food operations where you're serving food qualify for this order. If you're a congregate setting and you don't have a gym or you don't have any food operations, this does not pertain to that facility. Okay. All right, we have 1 more minute to go. And I want to thank you for your participation. What I would do is I will compile, we have lots of questions. I'll compile this list, and it will take me a day or two, compile this list, provide responses, and share it with the group or put it on the city's website. That is what I am going to do so that I can attend to all your questions, concerns, or inquiries. But like I mentioned, this order is not to be punitive to businesses. We analyzed data matrix and aligned our order with that of Chicago. And as Greg mentioned, we can see that cases are rising all over the place. And Evanston is not a bubble to say, even though our vaccination rates are high, that we are safe. Evanston welcomes people internationally across the border from other cities. This order is for us to get through the surge and for us to continue to protect our community members. And I will leave it at that. It is 4 p.m. I appreciate all the hard work that you do. And this is a worthy fight. Let us continue fighting the good fight. So thank you. And like I mentioned, I will address these questions and put it somewhere on the city's website or send it to you respectively. So thank you.